With your hosts, Dr. Lily Mundy, Raj Parikh, and Kyle Sanniec, this is the PRS Journal Club podcast.
Hi everyone, and welcome to the February 2019 edition of PRS Journal Club podcast. I'm Raj Parikh, PRS Resident Ambassador from Washington University in St. Louis, and I'm joined by my co-resident ambassadors, Lily Mundy from Duke University and Kyle Sanniec from University of Texas Southwestern. Today we have the honor of being joined by Dr. Ash Patel, Associate Professor and Chief of the Division of Plastic Surgery at Albany Medical Center. Thank you so much for joining us, Dr. Patel, for this PRS Journal Club podcast.
Thanks, Raj.
The articles that we will discuss can be read for free on prsjournal.com and including an archive of all past PRS Journal Club articles. The article we will be discussing is The Public's Preferences on Plastic Surgery, Social Media Engagement, and Professionalism, Demystifying the Impact of Demographics. This paper is from Dr. David Song and his group at Georgetown University and evaluates the general public's interaction with plastic surgery social media. To briefly summarize, the authors aim to gain insight on how the public finds plastic surgeons among various internet sources, how demographics shape the public's preferences, and how the general public interacts with plastic surgeons on a variety of social media platforms. The authors used an anonymous 31-question survey that was crowdsourced via mTurk, and 527 respondents comprised the study population. The average respondent was female and between the ages of 25 to 44 with a bachelor's degree and with children. The authors found a number of interesting results from their survey. 33% of responders follow a plastic surgeon on social media. Of those who do, an overwhelming majority, or 67%, use Facebook, while only 16% use Instagram and 7% use Twitter. A majority of the public used Google to search for plastic surgeons, and when combined, social media platforms were the most influential of all online methods in selecting a surgeon. Again, the overwhelming majority, or 2/3 of respondents, said that if they used one social media platform, it was Facebook. 61% of survey responders reported that an active social media presence reflected positively. Interestingly, 40% of respondents said they would not prefer to see a plastic surgeon's private life displayed on a professional social media page. Another really interesting finding, and concerning in many ways, is that when asked if a surgeon certified by the American Academy of Cosmetic Surgery is a plastic surgeon, 42% said yes, and 54% said not sure. Only 3% answered no. So I think this is a great place to start our discussion with Dr. Patel. And I think the first question we'll ask you, Dr. Patel, is how do you use social media?
This is a really interesting article because social media has really been a hot topic in the plastic surgery community over the last few years. So from a personal perspective, I have personal accounts on different social media platforms, so that's Facebook, Twitter, Instagram. I also have separate professional accounts, although I don't use them individually as much because being in academic practice, I'd have to manage them myself and it's very time consuming. And we're in the process of creating separate accounts for our practice. First one up will be Facebook. And I think in this current environment, particularly relevant to surgeons who are in private practice, to promote their practice to the public, they almost certainly have to have a presence on social media. And I guess, why would I have separate personal and professional accounts? It's really to keep my personal interactions with friends separate from the information I want to portray out to the public.
Yes, I think that's a great point. I'd like to ask Kyle and Lily, too, if you're engaged on social media, and if you are, what platforms do you utilize? Kyle, first.
I'm engaged on several different platforms. Twitter, I have a professional Facebook page. In terms of our engagement, how engaged we want to be, I don't use a lot of Instagram for kind of patient interactions in general. Just being under the university, we're still trying to figure out policies and things like that. So for me, the benefit of a social media presence for Instagram or things like that to get patients isn't as high, but some of the other residents use it quite a bit to bring in patients to the resident clinic. I do use Twitter a lot. I think it's good for promoting discussion, specifically about articles and those kind of forums. But a lot of it, our institution is still trying to figure out kind of what's allowed, what's not allowed, where the boundaries are in the boxes. We're not board certified plastic surgeons, we're still in training, but we still need to be trained on how to use social media because it's the wave of the future for our interaction with patients. So it's available to us. I probably don't use it as much as I should, but it's definitely something that we're using more and more here in Texas.
This is Lily. I have very similar feelings and thoughts that Kyle's brought up. I think for myself personally, social media has been something that I've really only used in a personal domain, sort of as a way to connect socially with my friends, not in a professional manner. But obviously this is something that's been coming up time and time again over the past couple of years within plastic surgery and within our residency program, sort of within our conferences and through the journal. So I think This has sort of become a personal question for myself and what I want my professional role or my professional type account or, presence to be. I think as someone who might be interested in a cosmetic practice or private practice, it seems very obvious that social media is going to be important for that. As someone who is interested in an academic career, pursuing an academic career, I think the question of social media becomes a little bit more abstract. Should this be something that your division has, a collective account that promotes all of the plastic surgeons within your division or your department, or is really the onus on the individual surgeon to have their own account? Dr. Patel, maybe you can expand upon that. You mentioned just sort of the overall time consumption of partaking in social media from a professional standpoint and what your thoughts are and the best way to integrate social media into an academic setting.
There are many different ways that we can use social media within a plastic surgery practice. From the academic side, Twitter has really been great in terms of being able to promote papers that we might have written, to ask questions of authors, and we've definitely used that as part of PRS Journal Club. And then moving into some of the other things on Facebook, even like on Facebook Live, and there are multiple other closed groups which you can join by invitation, where people are posting clinical questions, and we really get to kind of share a lot of ideas of certain problems. So I think that there's a lot to be gained from the educational perspective that would be relevant to someone in an academic setting. And the contrast to that is the promotion of a practice, particularly of an aesthetic practice, which people can even have if they're employees in an academic setting, but really trying to get information out to patients to engage them, to make them want to come and see that particular surgeon.
Thank you, Dr. Patel. I agree, and as Lily and Kyle said, I'm engaged on different social media platforms. This is Raj again, through Twitter and Instagram, and then over the years, my Facebook presence has somewhat diminished. One of the interesting things I found from this article that Dr. Song and the co-authors talk about is that Facebook seemed to be the preferred online method, almost by an overwhelming majority of the survey respondents, for social media engagement with plastic surgeons. And then did this surprise you, Dr. Patel, given the popularity of Instagram and the shift, at least among the younger generation, to using Instagram and Twitter more frequently? Or is this something that you were aware of?
I previously was the chair of public education for ASPS, and the society and the staff members collect a lot of data about social media interactions with the society, information, the website, and the social media messaging. And Facebook was actually the most popular site for the society. But Instagram has really been growing at the fastest rate over the last couple of years. And I think we're probably going to see some changes. I definitely think there are certain demographics that gravitate to different social media platforms, and Instagram has a younger age group who tends to use that predominantly. With regard to this paper, one of the flaws, the authors do mention it in the discussion, is the selection bias that's involved with the people who participated. MTurk requires people to be relatively internet savvy. And then furthermore, to select this particular study, you may have already got a population that's very much into social media and very much into plastic surgery by selecting this particular project. So I'm not entirely sure how meaningful those particular statistics are.
It seems hard to be able to generalize just from, even though it seems like a large number, 527 respondents compared to the mass amount of patients that interact on social media today. Do you think that social media has overtaken word of mouth and practice websites as being the most influential of all methods for patients selecting a surgeon, both for cosmetic surgery but also for academic practices? When you look at things such as breast reconstruction, the network for patients is very large on social media.
I think the practice website is probably still the most important media that plastic surgeon needs to have and to have information on, but social media has definitely moved up the ranks. I think in terms of promoting a practice, social media is definitely going beyond where people had print advertisements. The message can spread out much further than you could possibly do if you had yellow pages or print advertisements, which is what people used to have many years ago, and people still have to this day. And I foresee this being the new norm. I think social media is going to continue to grow, and we're already in a situation where most people who have internet access across the planet are on some social media platform, and that's not really going to go away.
Dr. Patel, this is Kyle here. Just had a question on going off that comment. So this is kind of what I've wondered and struggled with. So there are surgeons who are very much out there and they embrace Instagram and the social media, and that's kind of their platform. But, getting back to that point, do you think there's still a spot in the world for people who want to go back to maybe a word of mouth, less social media presence. My thoughts are there are a large subset, maybe a non-vocal majority of patients who don't like their surgeons being out posting all the time and being that interactive and engaging on social media. And in Texas, there's a subset of patients, especially in aesthetic surgery, that have left surgeons who are starting to engage more in social media and transition back to more of the older philosophy surgeons who don't have as much engagement. And so I want to know what your thoughts were on specifically that. Do you think it's, we all just need to get on board the social media train, or do you think there's still room for people who do not want to be as engaged with social media to still have a viable, successful, thriving practice going into the future?
Yeah, I think there's some important points to consider here. Going back to what you had mentioned earlier, Kyle, I think following institutional or society codes of ethics and policies is really important for surgeons. So perhaps some of the hesitation is for patients who see an active surgeon who's active on social media to be worried about whether or not their image is going to be sent out, that potentially pictures or people might get an idea that they're seeing a particular surgeon. So we have to be very respectful of what the patient's wishes are and respect their privacy. On the other hand, for a surgeon who might be early in practice, they may want to embrace social media to help get themselves busier, help promote themselves. But when you have someone who has a mature practice, they may say that the word of mouth is sustaining their practice enough that they don't need to necessarily keep building more interest through social media, so they may tend to scale back. I know that there are still some surgeons out there with mature practices who don't have websites, but similarly, I think there are surgeons who've had mature practices who are building websites and building social media presences just because there's a demand for that.
This is Lily. One question that always sort of comes up in my mind when thinking about your social media presence is, what do you think sort of the general referral patterns that you receive from patients who are actually following you on social media or find you on social media and sort of following through with surgical procedures? Or do you think this is more of a box, so to speak, someone has to check that when someone's identified you through maybe a different medium that they then want to evaluate what you have to offer maybe through your social media pages in process of coming to see you, if that makes sense?
I think patients don't just use one source of information when they're trying to make those decisions. I think they probably go to multiple sources to validate their opinions and decisions about who they want to go see. Patients have certainly said that to me, that they Googled my name, they looked on different social media, they looked on Facebook, and then they looked at the practice website to decide that they wanted to come and see me. So I think it's not as one-dimensional as we may think based on what's described in this paper, but they're definitely going to different avenues. One of the things that I try and do to help in the era of patient ratings and age caps and things like that is whenever there's a very happy patient, I tell them to go on social media and post about how happy they are about the treatment that they received. And I think that also helps from the institution's perspective, but also helps with the linking back to other sites of information. And again, it's the word of mouth effect, but on social media.
One thing that I've sort of come to appreciate is just the real uptick in number of papers we've seen recently discussing social media. And a lot of them sort of like this, it's sort of hard to interpret what they're really telling us or what they're really going to change our practices. Do you feel like there's some questions that haven't been answered about social media, or is there a better way to design some of these studies that we can get more sort of robust data that really might influence how we look at or how we utilize social media?
Absolutely. I think there are several different questions that really haven't been answered. How does patient engagement relate to the perceived quality of the posts? Do patients get deterred by repetitive posts? How about if surgeons are using automated services or bots to try and increase the number of posts? Does that make patients not want to see that surgeon? Do patients tend to like posts about specific procedures or treatments? Do surgeons see an uptick in patients requesting those when they post about it? And how do surgeons deal with negative posts about them on social media? Because we have to remember, social media can be a double-edged sword where positive information can also be countered by some negative information. And I think that's one of the reasons why it's important for us to be on social media, because that allows us to try and control some of the message.
I think that's definitely true, that being engaged on social media, especially as board-certified plastic surgeons and plastic surgery trainees, does represent our specialty appropriately. One of the really interesting things that I mentioned in the summary for this paper was that the majority of the public, at least the ones queried in this survey, didn't understand the difference between an ASPS board-certified plastic surgeon and an American Academy of Cosmetic Surgery certified provider. As a group, how can we do a better job of educating the public on who we are as plastic surgeons, what we do, and then also our qualifications to provide treatment in the different areas that we do?
It's been a very challenging problem for specialty to address. Certainly the ASPS has been involved in that over the last several years with the Do Your Homework campaign and the annual media outputs, whether it's on the television or on the internet, about people doing their background research on the provider that they're seeing. I think the recent legislation that passed in California about advertisements related to board certification and the American Academy of Cosmetic Surgery will help in some way in California with regard to that. Again, it's really important for our colleagues, for us all to be out there all delivering the same message, because we have a lot of other people out there who are trying to deliver these procedures, trying to perform these procedures. And for us, where patient safety is so important, the quality of our work is so important, and given the background of our training, we need to be out there making sure that the patients understand that there is a difference.
Yes, I think those are all excellent points. I think the ASPS has definitely done a good job of campaigning for that, as well as a lot of leaders in our specialty. And I think going forward, it'd be very interesting to see what comes of those efforts and what new developments come to play. I just wanted to end with one last question, Dr. Patel. In your role as a division chief, this is something Lily, Kyle, and I have talked about, and a lot of our co-residents discuss all the time, but what do you think regarding resident engagement in social media, and even taking it even further to medical student engagement? Is this something you encourage or discourage or even look at?
I do look at it. It's something I actually encourage, but I think everyone on social media has to be aware of the fact that every post is there on the internet forever. It lives forever, and there have been numerous instances, even recently, of old social media posts coming back to haunt people. The recent case of a resident, thankfully not in plastic surgery, but at an institution in Cleveland, who was dismissed because of offensive remarks on social media from the past. So it's important, I think, when people are on social media to realize this isn't an anonymous forum. It's just like real life. And if you make offensive remarks, there are going to be potential consequences for that. And we need to also make sure that we're respecting our patients on social media, that there are certain rules and boundaries that we have to live within when we're on social media. One of the reasons I think it's important for residents to be involved in their training is so that they can really learn about what those boundaries are and how they can be responsible with their social media messaging as they move on and have successful careers.
Thank you, Dr. Patel. Kyle and Lily, did you have any other thoughts?
No, I think Dr. Patel hit it on the head with getting residents involved in their engagement. We've seen some institutions where they are absolutely against social media and do not allow any of their residents to do any social media engagement, with the thought being they're not board certified plastic surgeons. There's no reason for them to engage. It's not their patients, it's the faculty patients. And so it's refreshing for Dr. Patel to come out there and kind of have this new idea of it's important for the people who are already board certified to train residents in what are the ethical, responsible ways to engage with patients on social media. And I hope, at least in the future, more and more programs transition to that, as they're not just training residents to be great surgeons, they're also training them to interact in the surgical ward they're going to be in, which is going to involve social media.
I agree, and I think just like our training is not only focused on our ability to operate and be a doctor and a surgeon, we have to learn how to code and we have to learn how to, run a business if that's something that's part of our practice model. I think, this is just one of those things that we're going to have to learn how to do, and, figuring out how to navigate that balance of the professional and personal boundaries of social media is really important to focus on during residency.
I agree completely. I think those were all excellent points. I think with that, we will end the discussion of this article. Thank you, everyone, for a great discussion. If you like this podcast, please feel free to share with your colleagues and friends and rate us on the Apple iTunes Store. Also, remember to tune into the other 2 articles that we will be discussing on this month's podcast. Finally, please join us for our monthly journal club on Facebook, where we will be able to interact directly in real time with this month's selected articles' authors. Go ahead and like the Plastic and Reconstructive Surgery Facebook page if you've not already done so. That's where our monthly journal club takes place.
Thank you for listening to the award-winning PRS Journal Club podcast. Be sure to read all of the articles being discussed, including some of the classic pairings from the archives, for free on prsjournal.com.